Hi, everybody. This is next in our series of vital lessons with Dr. Vin Gupta and with me, Randi Weingarten. This series, which we are honored to co-host as well as others, is designed to give our members clear and trusted guidance on issues that shape our schools, healthcare settings, and public service workplaces. And tonight's focus is really important and very close to home because across the country, LGBTQIA plus individuals are facing increasing attacks in schools, in healthcare, in sports, in daily life. And these attacks really affect young people who need support and stability. And they are deeply affecting educators who are both LGBTQIA plus, as well as educators who are queer allies, as well as educators who just are part of our bigger community. And so, we need to figure out how to help support everyone. And that's why AFT is having this conversation. And there's another reason. Because AFT members are often the first adults LGBTQIA young people turn to when they feel unsafe or unsupported, whether it's a teacher or a school driver, a nurse, a counselor, someone who's a higher ed professor, or frankly, many public employees. They create environments for young people to feel safe, to feel that they belong, particularly if they're so isolated. So that's why tonight we're talking about the current state of LGBTQIA health plus and including the data that shows and what, the data that actually really does show that young people who are LGBTQIA plus are really at greater risk. Now, let me just say, I am a lesbian. I normally just say gay, but I want to use the word LGBTQIA plus or the term because I want to make sure, at least for the first few times, that everyone feels seen and everyone feels like we are talking to them and talking with them and talking about them. But how do we support folks who are queer, students and colleagues that face discrimination? What does affirming care look like in schools, but mostly, actually, it's not in schools, but in healthcare settings? What does affirming care look like? What does climate and environment of care look like in education settings? And what everyday help to create belonging and to protect mental health must we do? So that's why this conversation is going to be really important. It's not a lecture, it's a town hall. Share your questions, your Q&A in the chat box. But the conversation is with two people who are extraordinary. First is my partner in the series, Dr. Vin Gupta, who brings deep experience as a physician, a pulmonologist, a professor, and a major in the United States Air Force Reserve Medical Corps. And I see his shining face coming on the screen. And the second is Casey Pick, the Senior Director of Law and Policy at the Trevor Project. Casey leads their national work to advance policies and practices that protect LGBTQIA plus youth and this is really important, to ensure they have access to crisis support and affirming care. We are grateful that Casey is with us, and we are grateful, frankly, for the Trevor Project that has been a lifesaver to so many young people for so long, and a project that we are happy and honored to support. So Vin and Casey, take it away, and I'm going to try to figure out how to make my camera work so I don't look like I'm, looking across at you instead of looking direct at you. Thank you.
Thanks, Randi. As always, thank you to Randi Weingarten, AFT President, for supporting what we're doing here with Vital Lessons from the very beginning. Randi and I first started working with each other during the pandemic on. Sorry, Randy. Oh, I thought I'd heard Randy. I just want to say thank you. And to all of you that chime in or that view these national town halls, we are trying to fill the void in effective, clear health communication on a variety of topics. I won't rehash the syllabus that we've done.
I can't hear you guys. Can you hear each other?
Yes, we can.
Okay. Okay. It looks like Randy might not be hearing audio, so Callie, I'll defer to you on troubleshooting that.
Yeah.
Okay, you can hear. Okay, great. Fantastic. So a lot to get through. We're going to make sure that, as always, we keep these town halls ending at the top of the hour to just make sure that we know everybody on this call is busy. We're going to have this spread digitally afterwards, so the key points will be syndicated, since we know that this time sometimes is difficult for the entire country. It's really hard to find a right time, but a lot to get through when it comes to key issues in LGBTQ IA plus health. And I'm going to be learning a lot, of course. There's a lot to get through. And but I wanted to start out just by talking about really key things here before I kick it over to Casey. Actually, Casey, why don't you do an introduction, if you don't mind? Just kind of what your role at the Trevor Project, a little bit about the Trevor Project.
Sure, absolutely. Thank you so much for that. The Trevor Project, for 27 years now, has been the leading provider of suicide prevention and crisis intervention services for LGBTQ plus young people. What that looks like today is that any queer young person who finds themselves in crisis can reach out to us 24/7, 365 days a year, via telephone, chat, or text, whatever they're most comfortable with. We also have some very strong suicide prevention programs, whether that be our research team, which provides national surveys of tens of thousands of LGBTQ plus young people, asking questions about their mental health, what they find to be helpful, what they find harmful, and providing that kind of research and data into the public conversation, which is so critical, especially now in a moment where so many sources of data are going dark. We also provide public training for people who interact with young people, whether those are physicians, doctors, teachers, companies. If you're in a place to positively impact the life of an LGBTQ plus young person, we want to be able to help provide training on how to do so in a way that is inclusive, that is accepting, that is rooted in data and research. And of course, you have my advocacy team. My job is to try and make sure that the mental health of these young people is at the center of the conversation, whether we're talking about federal government agencies or the state house across any of our 50 states. Often that looks like trying to elevate the need for greater resources, things like 988 and the specialized services that we had for 3 years that were unfortunately discontinued this summer. And all too often these days, I find myself playing defense, explaining why the thousands of pieces of hostile legislation targeting our community are seriously detrimental to the mental health of our young people, and trying to just elevate the needs and the realities of young LGBTQ lives.
That's fantastic. Casey, thank you so much. I'm going to, for the audience, I'm going to be bringing Casey in throughout. And so this is slightly different from maybe some of our others where I yammer on, and then 20 minutes later, our discussant comes in, because truly I want you to have the nation's experts here really talking about these vital issues. And I'm much more a student than anything else, and learning along with all of you. I do want to just emphasize, lots of issues that I think have obviously been talked about in the news. We're going to focus on the state of LGBTQIA plus healthcare, talk about how students and parents are impacted, and really how to focus on mental health well-being and really promoting that, make sure that we have an understanding of what we can do to get access to needed services or to help people that might be struggling. I want to just take a quick step back and focus on what's been happening. So just a quick summary here. This doesn't give me any pleasure to go through what has been a very difficult set of, I guess, just setbacks for healthcare for those in the LGBTQIA plus demographic since the Trump administration has taken power. We've seen this under rollbacks to the non-discrimination protections, Section 1557 of the Affordable Care Act. That was weakened. Protections under Section 1557, which really prohibited discrimination of healthcare provision or the delivery of healthcare programs on the basis of sex. That was significantly weakened by this administration. They've rolled back explicit protections for gender identity, making it harder for folks, say, transgender people to access care. If insurer has decided to not cover something for somebody that might be transgender, that rollback or that weakening of these protections based on gender identity actually makes it harder for people to promote or to fight maybe an unjust insurance claim or insurers denying their access to care. We've seen rollbacks to PEPFAR at the global level, cuts to HIV/AIDS prevention and research. We've seen transgender health and gender-affirming care capabilities through Executive Order 14187. I'm just looking at a few notes here, be systematically weakened. Defunding and censorship of LGBTQIA plus health research and resources through the NIH. Studies specifically NIH funded focused on this population have been defunded. Suicide prevention and mental health services, the 988 suicide prevention hotline, that national hotline focused on suicide prevention, had as option 3 the ability to get LGBTQIA plus tailored services if you called in, and that option has now been removed. So a lot here. It's almost too much to get into holistically. But I wanted to, Casey, give you the floor here to make sure, one, I've got that right. Please correct anything I might have gone wrong. And two, just to sort of hold court here on these policy developments.
Certainly. And yes, you've managed to run across the scope rather well, particularly with regards to that erasure of 988 Press 3. Which was something that the Trevor Project was actively a part of. We led that subnetwork for 3 years. We were the sole provider for a year as the pilot. And during that time, more than 1 million contacts were served who specially reached out asking for help as LGBTQ young people. Similar to how the 988+1 option serves our veterans and our military folks. It's not about identity, it's about providing services for the folks who are at greatest risk. And the challenge that we are facing right now, whether it be state laws and policies that are prohibiting access to certain healthcare just for trans people, but not the same care for cisgender folks, or the federal government taking a posture that there is only male and female as defined by a junior high level of a science class, and that nothing else exists and that can never change, results in policies that are either actively barring access to care or significantly chilling the access to care. When we know that federal government agencies are sending subpoenas to children's hospitals, asking for data about transgender young people's health care, these subpoenas are being squashed immediately by the courts. But we are finding ourselves in a world where it is frightening to provide the kind of safe, affirming, evidence-based care that we know is what saves lives.
And Casey, I just want to jump in there because there was other things too I've noticed. Again, just doing whatever I can through my platforms and through our sort of communication channels to focus on unmet need in this community. And I was surprised to see, I shouldn't be surprised, I guess, but that there was an executive action under the current president that redefined sex federally in a way that denied recognition of gender identity outside the binary. I'm wondering if you can speak to sort of these broader headwinds to this demographic, not actually being, just from a labeling standpoint, and how that heightens marginalization and how it impacts how they seek care. Because I'm assuming that this is cause a lot of fear and a lot of just unwillingness to want to seek medical care when people should be seeking medical care. Can you speak to that? Just sort of these meta ways in which I think that this community is being prejudiced against under this current administration, and what that means for their willingness to access care.
Absolutely. So just to absolutely just make the implicit explicit, this is not about politics. It's important to understand the real and damaging impact that these policies and the rhetoric surrounding them have on the health of LGBTQ people, and especially our youth. The Trevor Project's research has found that 90% of LGBTQ plus youth have said that recent politics negatively affected their well-being. And peer-reviewed research that our team published last year has actually found that anti-transgender laws directly caused an increase in suicide attempts among transgender and non-binary youth, up to 72%. And that was research that we published last year. There's a lot that's happened since we did that research. And so while these laws are causing... Yeah.
Sorry, go. No, please finish your thought.
I was just going to say, while these laws are causing direct harm, it's also the knock-on effect, the fear, and the fact that much of the advice that I would typically offer on how, whether it's doctors or teachers, can provide care and provide that safe and accepting environment to LGBTQ young people, many people are afraid to act on that, whether it be including your pronouns in your signature block, whether it be ensuring that your intake forms as a doctor leave space for somebody to describe their own gender, whether it be putting up a pride flag so that people know that they will be accepted. These are all things that are tremendously powerful, and these are also the same things that people feel hesitant to do in the current environment.
I should add, thank you for that, Casey. That's really powerful. The impact on marginalized groups within the LGBTQIA plus community, many in that community rely on Medicaid for basic primary care, especially those with chronic illness, HIV, if they're low income otherwise, without other options, say through their employer. So changes that destabilize Medicaid very much impact this community, coupled with the synergistic impact on labels and the use of these sort of, these tools really cause fear. It's really quite the 1-2 punch. I should also note that this administration has created or strengthened protections for healthcare providers and healthcare institutions. Casey, please elaborate on this if I don't get this completely correct, that want to refuse care to somebody in this demographic. I'm wondering if you've seen that play out, or the knock-on effects of something like that.
I know that the fear of it is very real. In this area of mental health care, for example, we know that about 90% of LGBTQ plus youth will tell us that they want some kind of mental health care or support, but only about half of them are able to get it. And when we ask our young folks, why not? Like, what are the barriers? Some you might well expect, cost, but very, very high on that list are also things like fear that my doctor won't understand me, fear that I'll be outed, fear that I'll have to get parental consent. And also people are talking about it's just harder to get care, and the ability to find somebody who will understand them as LGBTQ has never been easy, but feels like it's only getting harder these days.
Casey, thank you. And I'm glad that we're sort of fireside chatting this, because I think this is, honestly, this is helpful for me. And I'm assuming a lot of people are just learning a lot here. I want to get to the ultimate question here, was what can people do to better understand their rights and responsibilities when some of these policies show up in their own local communities, schools, workplaces. But I want you to talk through what we're looking at right now. More than 600 anti-LGBTQ bills have been introduced in the U.S. since 2025. I know I sort of summarized a lot of those efforts and bills at the federal level, but talk to us about what these varying shades of purple mean at the state and local level.
So the darker the state right now, the more bills you're looking at. And what that effectively amounts to is a daily deluge of hostile news, rhetoric, and of rights lost, of your ability to engage in the public sphere shrinking. And so whether that be the 24 states that have prohibited families and doctors being able to provide young patients with the medical care that they deserve just because they're trans. When you have restrictions on what bathroom you're able to access, including in government buildings. If you can't access a restroom where you feel safe, then you can't go to a lot of places, whether that be school or a courthouse or anywhere that you need to act in public. So we're seeing far too many of those laws coming back around. Many of these debates start with the issue of access to sports, something which may feel trivial, but for me, I can tell you that the one accepting adult I had in junior high and high school when I was coming to terms with my sexual orientation was my volleyball coach. And the reason I got out of bed and went to school was because I had the chance to go to practice. And it was the one place that I felt like I had friends and people who counted on me. So when we ban trans youth from being able to play sports, we're not just talking about sports. We're talking about that source of an accepting adult and peer support and belonging, things that we know save lives. There's so much else going on with this. You have these states that are themselves defining sex to merely mean man, woman, and to have no room for trans people in that, in a way that is profoundly dangerous if we're thinking about things like what prison are you assigned to, or what homeless shelter. There was a day when I was 15 that I came home and found the locks changed. I spent a couple of days in a government institution and thinking that was a brutal experience, and thinking about what would have happened if I was a trans person experiencing that and put in the wrong space. No wonder this is one of the worst healthcare situations we have. So yes, we are looking at a very difficult situation at the state level, and a lot of ground that we had made over time to recognize the reality of the complexity of people's lives. A lot of the complexity is what is leaving the conversation right now. We're being forced back into a very simplistic structure that has very sharp edges that are hurting a lot of people.
Casey, something that we're getting a few questions on, and I know you're prepared for this, and but I want to make sure, and for those watching live, please, we want to make this as soliciting of your questions as possible. Andy is asking, what are some small things educators can do daily to signal safety and support for LGBTQIA plus students, especially in schools with hostile policies? So let's look at that map. And if you're an educator in the Southeast United States, based on this map, wondering, this is a nationwide phenomenon, clearly, but especially in the hot spots where there's a lot in the way of challenges from a legislative standpoint. What can educators do to signal safety? What can parents do to do the same? How can communities bandy together? So maybe 3 questions in one.
Absolutely. I believe I dropped into the chat that is visible to attendees an actual resource that the Trevor Project has created. It's a checklist style resource for educators and school officials to answer this exact question of, is your school welcoming for LGBTQ plus students, and what can you do? Now, I recognize, given the patchwork we're in, that not all of these suggestions will work for everybody, but it's a good starting point, and it's a good conversation to have. It ranges from ensuring that schools have anti-bullying and harassment policies in place that explicitly name sexual orientation and gender identity, on down to having those visual cues of allyship, whether that be adding a safe space sticker, some kind of rainbow flag. Again, I know this is harder than it used to be, but those signals still mean so very much. We also include research on the mental health crisis among LGBTQ plus young people and the real impact that we know these kinds of policies and resources have. Something like including LGBTQ people or issues in curriculum showed a 23% lower odds of attempting suicide in the past year compared to students whose curriculum wasn't inclusive that way. So these are things that are worth fighting for. And also, I really want to call out that the Trevor Project, together with the American Foundation for Suicide Prevention, National Association of School Psychologists, and others, work together to create the model school policy on suicide prevention, so that every school should have in place a plan for what to do in a moment of crisis, how to try to prevent that, including training for your teachers and counselors, like the training that is provided by the Trevor Project, and how to respond following a crisis so as to ensure that we minimize the harm, which sadly is where we are today, knowing that we are in the hard moments and we need to prepare for them.
Fantastic. Casey, I just have to say, we've been doing this for a while now, and we have the nation's best based on various topics in healthcare and public health. And you're just doing an incredible job. And I really appreciate this. Randi, I know you're in a car, but I wanted to kick it to you if you can hear me.
I can hear you, and can you see me and hear me now? Or no?
We can see you. We definitely can hear you, and we can see you. Yes.
Oh, good. So am I, can you see me in portrait mode or landscape mode?
Sort of,
or is
somewhat
it
landscape. Yeah, it's like a hybrid.
Far be it for me to say, but I think your orientation was correct until just a second ago.
Okay. Let's see if I can do it this way.
Right there. Don't move the camera. Oh, no, you had it.
Just like that, right?
Perfect. Yes, perfect.
Okay. So what I wanted to ask you, Casey, I agree with Vin in terms of this. It has really been an amazing dialogue. But what do we do? And I think this is what many of us are thinking. What do we do when you can't, when you're in a place like Texas or upstate New York or in Florida, where the laws are so arrayed against us? Should we do things like have a general policy on bullying, a general policy on these kind of things? Should we create, real communities of interest together for people who are like-minded? So we have a bunch of people who are protecting our kids. Should we look for the creation, or should we create a gay-straight alliance? Should we look for, is there an HRC chapter around, or for something else? I'm pushing on us to do some very practical advice too.
Absolutely. So my answer on that is all of the above and all that you can. We are very much in a space where if what you can do and the best you can do is to strengthen the conversation about mental health generally and getting those resources out there and increasing empathy, a willingness to talk about hard things, a willingness to make life more complicated than the simplicity we're being shoved towards. If that's all you can do, then that takes us a long way. There are absolutely local resources that people can get connected in with. State equality groups through the Equality Federation. So Equality Texas and the Texas Education Network for Transgender Issues, TENT, are fantastic. Most states have these, and they can help plug you in to local engagement. The thing that is really valuable right now is that we do have, people are feeling the push, and they are coming together, uniting, so you are not alone if these issues matter to you. People are organizing, join them.
So that's why I want to take that, what Casey just said, Kelly, and I want us, when we do the the one pager that we do within, let's have a longer resource list today about these other places and these other affinity groups. I think it's really important here because people will get very lonely and feel even more isolated if they try to do this alone in a school and there's not the conditions for doing this.
Yeah, nobody should ever feel alone in this.
Right.
Absolutely. And so just for the audience, and as I think a lot of folks have gotten used to, we will make sure that we syndicate some small clips from this and put this on social. Casey, pretty much the whole thing could be clipped because this has been so chock full of amazing information, and that we will be doing a one-page summary that we'll make sure is readily available for everybody in the AFT community and frankly the general public, because this is open to the public. Randi, I want to come to you for a moment. And
Sure.
There was a question in the chat specifically asking, how can unions or educator networks support LGBTQIA plus teachers who are feeling isolated or under attack? Wondering your thoughts on that.
Well, you know, what we try to do as a union is we try to have, you know, pockets throughout the country. First off, let me just say, if you are a member of our union, just know that these are issues on a very personal basis I take very seriously, and obviously on a professional basis we should all take seriously. But I remember what it was like to be a closeted young person, and I remember what it was like to be closeted for many, many years before I wasn't. And I take, so we've been trying, we have a committee nationally, a task force nationally. We've been trying to educate our locals that this is, that homophobia is as noxious as every other racism, and that our obligation is to create a safe and welcoming place in our schools, in our campuses, in our lunchrooms, in our union, for everyone. And so what I would do if someone feels really isolated, write me at uftpres at aft.org, AFT Pres, P-R-E-S, AFT, P-R-E-S, at aft.org, write us, and we'll try to make sure that we can connect you with any of our 3,800 locals or connect you with our state federations to make sure that you're not alone. If you're in an AFT local, then we'll try to do the connection in a way that's real and meaningful on a local level. And if you're not, we'll try to do something on the state level or on a national level, or find one of these other groups so that we can actually organize a community around you. And we'll try to do that.
Then if you're talking, I can't hear you.
Oh, whoops. Okay. Thank you, Casey. Randi, that was fantastic. I just wanted to make sure I have the right email. It's aftprez at aft.org, which I put in the chat.
aftpres at aft.org.
Okay, I'm being too colloquial. AFT Press. So sorry, folks. Stacy, PRES. I'm glad we rectified that. And we'll put that into the one pager as well. Yep. Okay, I want to get us back on, Casey, back to you. There's a lot here. I wanted to spend a little time on this because there's a lot of terrible rhetoric right now, and wondering how you approach, well, walk us through this. How would you recommend somebody approach combative, insensitive rhetoric at this moment towards this broad community?
I think it depends on the context. If we're talking about in a classroom, then your priority is making sure that people feel safe. So, you know, be cautious about how you entertain that. But if we're talking about a discussion between adults, between folks who are genuinely curious on these topics, then my priority really is to lower the temperature. So much of this conversation is rooted in misinformation. So much of it has been coming out of millions of dollars of campaign ads that are meant to scaremonger people to the polls. When we actually are able to have a conversation about just LGBTQ people wanting to live their lives, then we can get into it. We can have the nuanced conversation where, yeah, I have some tough conversations with folks about everything from sports to healthcare, and we can have those conversations. But I think really it's important to lead with empathy, lead with the reality that we're all learning on this. And I try to listen a little bit before I start talking back to really understand what people are concerned about. Most folks I know, they want the best for their kids. They want the best for all of our kids. And they certainly want to help keep them alive. The challenge is just, what's the best course for that? I also am able to, I'm lucky. I work at the Trevor Project, so I can point them to our resources page, the trevorproject.org/resources, which has really accessible guides on everything from what do these words mean? It seems like the vocabulary about these issues is changing so fast, and people are frustrated trying to keep up. I can help provide a resource on that. On over to what does it mean to be an ally to a trans or non-binary person? Something that even honestly, lesbian and gay folk like me, we've got a lot of learning to do too. So I try to lead with humility. I try to model empathy. And I just try to remind us all that we're all dealing with the cards we were dealt. And there's a lot going on here.
We got a question in the chat. Thank you, Casey. And I'll just read it directly. How can parental concern over trans students playing sports be addressed? We had parents who said that a male that transitioned to female should be exempt from sports because of safety issues. Obviously, the president has made, this was almost an election campaign issue. And the blast radius of impacts from just the insensitive way we talk about this and other topics that are related to it has been helping. And I am curious how Trevor Project thinks about an issue that's become very political.
Yeah, absolutely. So again, we really try to put this issue into perspective. If you were to listen to the campaign ads in my home state of Virginia before the governor's race last week, you would have thought that there were a massive, overwhelming number of transgender athletes taking over sports, when the reality is we're talking about a small number of kids. Honestly, most LGBTQ folks, like, we are underrepresented in sports because of the discrimination, the fear, the fact that these are still hard places to be. So we're talking about a small number of kids here. And that's also important to note when we're talking about the issue of school sports. We're talking about a school activity, often children. And so wanted to keep in perspective, what are school sports about? It's about having that chance to exercise, to spend time with your friends, to get out and use your body in a way that feels good, to all of the things that we use school sports for, learning leadership, learning teamwork. And so reminding each other what this is for, the reality that there's been a lot of fear mongering, but not a lot of actual harm that can really be pointed to. You've got trans athletes participating in sports. They've been doing so for decades. And you're not seeing the safety risks that we're told we should expect. And we're not seeing the experience of people being excluded from the playing field. So just really wanting to get real about it, get real about what these issues mean, and bring that temperature down. And know that when people are trying to make you afraid of kids playing games on a sports field, let's think about why they might be doing that and what are they distracting you from, when that's what more than half of campaign dollars are going into in a time when we could be talking about our economy or so many other things.
Casey, I know we don't, thank you. there's so much I want to ask you about, and realize that we don't have enough time. In the next maybe 5-6 minutes, if we could just do a treatment on the best ways to promote mental health and well-being from the Trevor Project's perspective, just kind of make us smarter here.
Sure. Top line I've got: foster belonging. Protecting mental health means you lead with empathy and a willingness to talk about mental health honestly and openly. And that means not being afraid to have the hard conversations and talk about really difficult feelings. And that can include, at the extreme, if you think somebody's at risk of suicide, asking, are you thinking about killing yourself? Like, getting blunt and getting real matters, and being able to listen and know what your role is and when to bring in support, experts, even calling 988. And I will still say calling 988, even though they don't have the press 3 option more. But if you're talking to an LGBTQ young person, you can always remind them that the Trevor Project exists. We're still there, 24/7, 365. And something I also like to call out is what our young people tell us matters to them and helps them feel accepted and affirmed in ways that are beneficial to their mental health. So from our national survey, we asked, and the top answers they gave us: trusting that I know who I am, standing up for me, looking up things about LGBTQ identities on your own to better understand, respecting my pronouns, my name, how I choose to express my gender, asking questions and genuinely wanting to learn about LGBTQ identities, showing support in tangible ways. These are the things that LGBTQ young people tell us that helps them feel like they are safe, like they're accepted, and like they belong. In a broader space on just mental health issues more broadly, this is a conversation that is really picking up steam all across the US. It is one of the few things that still unites us, the recognition that mental health is hard and serious for us. Whether you are a senior citizen white man in rural America, or you are that queer kid on the coasts, and anything in between, we know that we're in a mental health epidemic these days. We know we don't have enough resources. We know that there aren't enough counselors. So what we need now is all hands on deck, and we need to get creative, and we need to work together.
Wow, Casey, it's again, you're sort of just blowing me away.
I can't think of a better way.
Go ahead, Randi.
Yeah. I was going to say, I can't think of Casey, of a better way of kind of ending this amazing webinar. I think that the notion that you said about finding a way to de-escalate, bring the temperature down, making sure that people have, community, all of these things are such practical, important ways that we can get that information to everyone.
It has been such a privilege to speak with this audience, to see your responses to the poll questions, to see your questions.
Then you want to take us off today?
Sure. I do want to, and maybe the best way I can is we have 4 minutes, and I don't want to lose. There was a really poignant question, and Randi, if you can hear us.
Then you want to take us off?
Yep, I'll take you off. I do want to, since we have 3 minutes at the top, Casey, and Randi, by all means, chime in if you can hear us. Casey, there was a question in the chat. I'll read it. Last month, Vermont lost a vibrant trans college student to suicide. As a professor, I worry that official responses or silence to such tragedies worsen the hostility my LGBTQ plus students face. Even a legislatively progressive state, we're failing to create safe spaces for vulnerable community members. How can professors respond to ensure students know about available supports? Even as a queer professor, the pervasive dehumanizing public discourse leaves me feeling inadequate in providing safety and hope for all my students. Casey, wondering if you can give us some direction. What a very poignant question on what sounds like a horrific tragedy. And Randi, also please do chime in. But Casey, to you.
Yeah, thank you so much for raising that question. Thank you so much for naming that event. It is a tragedy, and we know that we are losing far too many LGBTQ plus young people these days, far too many young people as a whole. Events like that are why having in place the model suicide prevention policy matter, so that you can have your staff be trained in advance on how to keep an eye out for warning signs, on what to say in the moment, how to try to prevent suicide contagion, something that is so very challenging in these events. I will say that silence is never the answer in response to a tragedy like that. It is important for LGBTQ youth to feel seen. It is important for the entire student body to have the opportunity to acknowledge that something really hard has happened. You don't want to be in a situation where you're putting a single story onto a pedestal. There are guidelines and advice on how to avoid suicide contagion. But the reality of these are moments when we need to talk about mental health, and we need to talk about the fact that it's okay not to be okay and to seek out help. And offering these kinds of resources and sharing them out, Trevor Project, 988, whatever is appropriate in your environment, you can never do that too much.
Wow. Again, I'm just blown away. Casey, I'm so grateful to have you and grateful for your work, the Trevor Project's work. We had a great audience that was very engaged, and these tend to get even greater engagement and syndication. So this was a true public service, Casey, and thank you for all that you do.
It's an honor to be here. Thank you for having me.
Thank you, Casey, and thank you, Vin, for all the things that you both do. And thank you, Casey, for really shedding the light this time on what we need to do for our most vulnerable these days, some of our most vulnerable folks. We really, 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 really appreciate it. And I just would end by saying, whatever we can do to create a safe and welcoming environment, all of us together, regardless of whether we are gay or straight or trans or bi or any or queer or none of the above, we have an obligation to try to create a safe and welcoming environment. And that's what we're trying to do tonight. And we just had two amazing guests in doing this work today. So thank you, Casey Pick, and thank you, Dr. Vin Gupta, for joining us today.
Thank you.
Thank you.